Question 1. A 72-year-old client with a history of chronic heart failure is admitted with worsening dyspnea, bilateral crackles, and peripheral edema. The nurse reviews the morning laboratory report and notes a serum potassium level of 2.8 milliequivalent/L. The client is receiving furosemide intravenously twice daily. While preparing to administer the scheduled medications, the nurse considers the significance of this laboratory finding. Which nursing action is the highest priority? A. Administer the scheduled furosemide as prescribed. B. Notify the provider and anticipate potassium replacement. C. Encourage the client to increase oral fluid intake. D. Restrict foods containing potassium. Answer. B. Notify the provider and anticipate potassium replacement. Rationale. A potassium level of 2.8 milliequivalent/L indicates significant hypokalemia. Severe hypokalemia can cause life-threatening cardiac dysrhythmias, muscle weakness, and respiratory compromise. The priority is correcting the potassium deficit and preventing cardiac complications. Question 2. A client receiving continuous intravenous insulin for diabetic ketoacidosis has the following laboratory results: glucose 280 mg per deciliter, potassium 3.1 milliequivalent/L, sodium 136 milliequivalent/L, and bicarbonate 18 milliequivalent/L. Which laboratory value requires the nurse's immediate attention before continuing aggressive insulin therapy? A. Glucose 280 mg per deciliter. B. Potassium 3.1 milliequivalent/L. C. Sodium 136 milliequivalent/L. D. Bicarbonate 18 milliequivalent/L. Answer. B. Potassium 3.1 milliequivalent/L. Rationale. Insulin drives potassium into cells, potentially worsening hypokalemia. A potassium level of 3.1 milliequivalent/L is already low and may lead to dangerous dysrhythmias if insulin therapy continues without potassium replacement. Question 3. A client with chronic kidney disease stage 5 arrives in the emergency department complaining of generalized weakness and palpitations. Laboratory results reveal potassium 6.8 milliequivalent/L, BUN 82 mg per deciliter, creatinine 8.4 mg per deciliter, and calcium 8.9 mg per deciliter. Which laboratory value presents the most immediate threat to life? A. BUN 82 mg per deciliter. B. Creatinine 8.4 mg per deciliter. C. Potassium 6.8 milliequivalent/L. D. Calcium 8.9 mg per deciliter. Answer. C. Potassium 6.8 milliequivalent/L. Rationale. Hyperkalemia above 6.5 milliequivalent/L significantly increases the risk for lethal cardiac dysrhythmias and cardiac arrest. This is the most urgent laboratory abnormality. Question 4. A client admitted with syndrome of inappropriate antidiuretic hormone secretion, SIAD, becomes increasingly confused and lethargic. Laboratory values include sodium 118 milliequivalent/L, potassium 4.2 milliequivalent/L, magnesium 2.0 mg per deciliter, and glucose 102 mg per deciliter. Which laboratory result most likely explains the client's neurological deterioration? A. Potassium 4.2 milliequivalent/L. B. Magnesium 2.0 mg per deciliter. C. Sodium 118 milliequivalent/L. D. Glucose 102 mg per deciliter. Answer. C. Sodium 118 milliequivalent/L. Rationale. Severe hyponatremia can cause cerebral edema, seizures, confusion, coma, and death. A sodium level of 118 milliequivalent/L requires immediate intervention. Question 5. A postoperative client develops muscle twitching, numbness around the mouth, and a positive Chvostek sign. Laboratory findings reveal calcium 6.9 mg per deciliter, potassium 4.1 milliequivalent/L, sodium 138 milliequivalent/L, and phosphorus 3.5 mg per deciliter. Which interpretation is most accurate? A. The client is experiencing severe hypocalcemia. B. The client has hypernatremia. C. The client has hyperkalemia. D. The client has hypophosphatemia. Answer. A. The client is experiencing severe hypocalcemia. Rationale: normal calcium is approximately 8.5 to 10.5 mg/dl. A level of 6.9 mg per deciliter can cause neuromuscular irritability, tetany, seizures, and cardiac complications. Question 6. A client receiving chemotherapy has a white blood cell count of 1,000/mm superscript 3 and an absolute neutrophil count, ANC, of 400/mm superscript 3. Which nursing action is most appropriate based on these laboratory findings? A. Encourage fresh flowers in the room. B. Implement neutropenic precautions. C. Restrict oral fluids. D. Encourage raw fruits and vegetables. Answer: B. Implement neutropenic precautions. Rationale: an ANC below 500/mm superscript 3 indicates severe neutropenia and extremely high infection risk. Protective precautions are essential. Question 7. A client hospitalized with gastrointestinal bleeding has a hemoglobin level of 6.7 g/dl and hematocrit of 21%. Which nursing intervention should the nurse anticipate? A. Iron-rich diet only. B. Prepare for blood transfusion. C. Restrict activity for 24 hours. D. Encourage ambulation. Answer: B. Prepare for blood transfusion. Rationale: hemoglobin below 7 g/dl often requires transfusion, especially in symptomatic clients or active bleeding situations. Question 8. A client with cirrhosis becomes increasingly confused and disoriented. Laboratory results show ammonia level 118 micrograms per deciliter, sodium 137 milliequivalent/L, potassium 4.3 milliequivalent/L, and glucose 99 milligrams per deciliter. Which laboratory value most likely contributes to the client's symptoms? A. Sodium 137 milliequivalent/L. B. Potassium 4.3 milliequivalent/L. C. Ammonia 118 micrograms per deciliter. D. Glucose 99 milligrams per deciliter. Answer: C. Ammonia 118 micrograms per deciliter. Rationale: elevated ammonia levels are associated with hepatic encephalopathy, causing confusion, altered mental status, and possible coma. Question 9. A client receiving warfarin therapy has an INR of 6.5 during a routine clinic visit. Which nursing action is the priority? A. Administer the next scheduled dose. B. Assess for signs of bleeding. C. Encourage increased vitamin K restriction. D. Increase warfarin dosage. Answer: B. Assess for signs of bleeding. Rationale: an INR of 6.5 indicates excessive anticoagulation and a high risk for spontaneous bleeding. Immediate assessment is essential. Question 10. A septic client has a serum lactate level of 5.6 millimoles per liter despite fluid resuscitation. Which interpretation is most accurate? A. Adequate tissue perfusion exists. B. Kidney function has normalized. C. Significant tissue hypoperfusion persists. D. Electrolyte balance is restored. Answer: C. Significant tissue hypoperfusion persists. Rationale: elevated lactate reflects anaerobic metabolism and inadequate tissue oxygenation. Persistent elevation suggests ongoing shock and poor perfusion. Question 11. A client with end-stage renal disease arrives for hemodialysis and reports muscle weakness, numbness of the extremities, and palpitations. The nurse reviews the laboratory results and notes: potassium 7.1 milliequivalent/L, sodium 138 milliequivalent/L, calcium 8.8 milligrams per deciliter, magnesium 2.0 milligrams per deciliter. The telemetry monitor displays peak T waves. Which provider prescription should the nurse implement first? A. Administer oral sodium polystyrene sulfonate. B. Prepare the client for emergency hemodialysis. C. Restrict dietary potassium intake. D. Encourage ambulation. Answer: B. Prepare the client for emergency hemodialysis. Rationale: a potassium level of 7.1 milliequivalent/L with ECG changes represents a life-threatening emergency. Emergency dialysis is often the most effective treatment in clients with severe renal failure and symptomatic hyperkalemia. Question 12. A client admitted with acute pancreatitis develops muscle cramps, hyperactive reflexes, and tingling around the mouth. Laboratory studies reveal calcium 7.0 milligrams per deciliter, magnesium 1.9 milligrams per deciliter, potassium 4.2 milliequivalent/L, and sodium 139 milliequivalent/L. Which complication is the nurse most concerned about? A. Tetany and seizure activity. B. Hyperglycemia. C. Bradycardia related to hyperkalemia. D. Respiratory alkalosis. Answer: A. Tetany and seizure activity. Rationale: severe hypocalcemia can result in neuromuscular excitability, tetany, laryngospasm, seizures, and potentially cardiac instability. Question 13. A client with a history of chronic alcoholism is admitted for alcohol withdrawal. The nurse reviews laboratory results and notes magnesium 0.9 milligrams per deciliter, potassium 3.4 milliequivalent/L, calcium 8.5 milligrams per deciliter, and sodium 136 milliequivalent/L. Which finding requires the most immediate intervention? A. Calcium 8.5 milligrams per deciliter. B. Potassium 3.4 milliequivalent/L. C. Magnesium 0.9 milligrams per deciliter. D. Sodium 136 milliequivalent/L. Answer: C. Magnesium 0.9 milligrams per deciliter. Rationale: severe hypomagnesemia can precipitate ventricular dysrhythmias, seizures, and sudden cardiac death. Magnesium replacement is a priority. Question 14. A client receiving unfractionated heparin for treatment of a pulmonary embolism has an activated partial thromboplastin time, APTT, of 128 seconds. The prescribed therapeutic range is 60 to 80 seconds. Which nursing action is most appropriate? A. Increase the heparin infusion rate. B. Stop the infusion and notify the provider. C. Administer aspirin. D. Document the finding as therapeutic. Answer: B. Stop the infusion and notify the provider. Rationale: an APTT of 128 seconds indicates excessive anticoagulation and a significantly increased risk for bleeding complications. Question 15. A client with diabetic ketoacidosis is being treated in the intensive care unit. The nurse reviews the following laboratory values: potassium 5.6 milliequivalent/L, glucose 610 milligrams per deciliter, arterial pH 7.18, bicarbonate 12 milliequivalent/L. Which laboratory value indicates the client remains in severe metabolic acidosis? A. Potassium 5.6 milliequivalent/L. B. Glucose 610 milligrams per deciliter. C. Arterial pH 7.18. D. Potassium and glucose together. Answer: C. Arterial pH 7.18. Rationale: normal arterial pH is 7.35 to 7.45. A pH of 7.18 indicates significant acidosis and ongoing DKA severity. Question 16. A client recovering from major abdominal surgery suddenly develops shortness of breath and tachycardia. Laboratory results reveal D-dimer 4.2 micrograms per milliliter, hemoglobin 12.9 g/dl, sodium 137 milliequivalent/L, and potassium 4.1 milliequivalent/L. Which interpretation is most appropriate? A. The D-dimer result may suggest thromboembolic activity. B. The client has severe anemia. C. The client has hypernatremia. D. The client has hypokalemia. Answer: A. The D-dimer result may suggest thromboembolic activity. Rationale: elevated D-dimer levels are associated with clot formation and breakdown and may indicate conditions such as pulmonary embolism or deep vein thrombosis. Question 17. A client receiving chemotherapy develops a temperature of 101.8 degrees Fahrenheit, 38.8 degrees Celsius. Laboratory results reveal WBC 900/mm superscript 3, ANC 300/mm superscript 3, platelets 180,000/mm superscript 3, hemoglobin 11.8 g/dl. Which nursing action is the highest priority? A. Administer antipyretics and reassess later. B. Place the client in protective isolation and notify the provider immediately. C. Encourage increased oral intake. D. Schedule discharge teaching. Answer. B. Place the client in protective isolation and notify the provider immediately. Rationale. Fever with an ANC below 500/mm superscript 3 is considered a medical emergency because neutropenic clients may rapidly develop life-threatening sepsis. Question 18. A client with chronic liver disease has the following coagulation studies. 3.8 Indian rupees. PT 38 seconds. Platelets 88,000/mm superscript 3. Which assessment finding would require immediate follow-up? A. Mild fatigue. B. Ecchymosis on the extremities. C. Appetite loss. D. Dry skin. Answer. B. Ecchymosis on the extremities. Rationale. Elevated INR, prolonged PT, and thrombocytopenia place the client at significant risk for bleeding. Bruising may indicate active coagulation impairment. Question 19. A client with severe sepsis has the following laboratory values. Lactate 6.2 millimoles per liter. WBC 19,000/mm superscript 3. Creatinine 2.8 milligrams per deciliter. Platelets 110,000/mm superscript 3. Which laboratory value best indicates inadequate tissue oxygen delivery? A. WBC 19,000/mm superscript 3. B. Creatinine 2.8 milligrams per deciliter. C. Platelets 110,000/mm superscript 3. D. Lactate 6.2 millimoles per liter. Answer. D. Lactate 6.2 millimoles per liter. Rationale. Elevated lactate reflects anaerobic metabolism resulting from poor tissue perfusion and inadequate oxygen delivery. Question 20. A client with acute leukemia reports fatigue, dizziness, and spontaneous gum bleeding. Laboratory studies reveal hemoglobin 7.2 g/dl, WBC 52,000/mm superscript 3, platelets 14,000/mm superscript 3, potassium 4.0 milliequivalent/L. Which laboratory value poses the greatest immediate danger? A. Hemoglobin 7.2 g/dl. B. WBC 52,000/mm superscript 3. C. Platelets 14,000/mm superscript 3. D. Potassium 4.0 milliequivalent/L. Answer. C. Platelets 14,000/mm superscript 3. Rationale. A platelet count below 20,000/mm superscript 3 creates a high risk for spontaneous and potentially fatal bleeding, including intracranial hemorrhage. Immediate bleeding precautions and possible platelet transfusion are priorities. Question 21. A 64-year-old client presents to the emergency department with crushing substernal chest pain radiating to the left arm and jaw. Initial laboratory results reveal troponin I 8.2 nanograms per milliliter, CKMB 32 nanograms per milliliter, potassium 4.1 milliequivalent/L, and sodium 138 milliequivalent/L. Which laboratory finding is most concerning and requires immediate recognition by the nurse? A. Potassium 4.1 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Troponin I 8.2 nanograms per milliliter. D. Both sodium and potassium levels. Answer. C. Troponin I 8.2 nanograms per milliliter. Rationale. Troponin is the most sensitive and specific marker for myocardial injury. A significantly elevated troponin level strongly suggests acute myocardial infarction and requires immediate intervention. Question 22. A client admitted with septic shock has the following arterial blood gas results. pH 7.28. PaCO2 32 millimeters of mercury. HCO3 15 milliequivalent/L. Lactate 5.8 millimoles per liter. Which interpretation by the nurse is most accurate? A. Respiratory alkalosis. B. Metabolic acidosis with respiratory compensation. C. Metabolic alkalosis. D. Fully compensated respiratory acidosis. Answer. B. Metabolic acidosis with respiratory compensation. Rationale. The low pH indicates acidosis. The low bicarbonate identifies a metabolic cause, and the low PaCO2 reflects respiratory compensation. Question 23. A client receiving total parenteral nutrition develops weakness, shallow respirations, and decreased cardiac contractility. Laboratory results reveal phosphorus 1.2 mg per deciliter, potassium 4.0 milliequivalent/L, calcium 9.1 mg per deciliter, and sodium 139 milliequivalent/L. Which laboratory value is the priority concern? A. Potassium 4.0 milliequivalent/L. B. Calcium 9.1 mg per deciliter. C. Sodium 139 milliequivalent/L. D. Phosphorus 1.2 mg per deciliter. Answer. D. Phosphorus 1.2 mg per deciliter. Rationale. Severe hypophosphatemia can lead to respiratory failure, impaired myocardial function, rhabdomyolysis, and neurologic dysfunction. Question 24. A client with chronic kidney disease has the following laboratory values. BUN 98 mg per deciliter. Creatinine 9.1 mg per deciliter. Potassium 5.9 milliequivalent/L. Hemoglobin 7.8 g/dl. The nurse must determine which finding requires the most urgent intervention. A. BUN 98 mg per deciliter. B. Creatinine 9.1 mg per deciliter. C. Potassium 5.9 milliequivalent/L. D. Hemoglobin 7.8 g/dl. Answer. C. Potassium 5.9 milliequivalent/L. Rationale. Although all values are abnormal, hyperkalemia presents the greatest immediate threat because of the risk of life-threatening cardiac dysrhythmias. Question 25. A client receiving digoxin for heart failure complains of nausea, anorexia, and visual disturbances. Laboratory results reveal digoxin level 3.1 nanograms per milliliter, potassium 2.9 milliequivalent/L, sodium 137 milliequivalent/L, magnesium 2.0 milligrams per deciliter. Which interpretation is most accurate? A. Therapeutic digoxin level. B. Digoxin toxicity likely worsened by hypokalemia. C. Hyperkalemia is causing symptoms. D. Sodium imbalance is causing toxicity. Answer. B. Digoxin toxicity likely worsened by hypokalemia. Rationale. Digoxin levels above the therapeutic range combined with hypokalemia significantly increase the risk for digoxin toxicity and dangerous dysrhythmias. Question 26. A client with suspected disseminated intravascular coagulation, DITC, has the following laboratory findings. Platelets 38,000/mm superscript 3. PT prolonged. APTT prolonged. Fibrinogen decreased. D-dimer elevated. Which interpretation is most accurate? A. Normal coagulation profile. B. Findings consistent with DIC. C. Findings consistent with dehydration. D. Findings consistent with iron deficiency anemia. Answer. B. Findings consistent with DIC. Rationale. DIC is characterized by thrombocytopenia, prolonged clotting times, decreased fibrinogen, and elevated D-dimer due to widespread coagulation activation. Question 27. A client admitted after prolonged vomiting has the following arterial blood gas results. pH 7.50. PaCO2 47 mm of mercury. HCO3 35 milliequivalent/L. Which interpretation should the nurse make? A. Respiratory alkalosis. B. Metabolic alkalosis with respiratory compensation. C. Respiratory acidosis. D. Metabolic acidosis. Answer. B. Metabolic alkalosis with respiratory compensation. Rationale. The elevated pH indicates alkalosis. Elevated bicarbonate identifies a metabolic cause, while the increased PaCO2 reflects compensatory hypoventilation. Question 28. A client with acute blood loss following trauma has the following laboratory results. Hemoglobin 6.5 g/dl. Hematocrit 19%. Lactate 4.9 millimoles per liter. Potassium 4.4 milliequivalent/L. Which laboratory value most strongly suggests inadequate tissue perfusion? A. Hemoglobin 6.5 g/dl. B. Hematocrit 19%. C. Lactate 4.9 millimoles per liter. D. Potassium 4.4 milliequivalent/L. Answer. C. Lactate 4.9 millimoles per liter. Rationale. Elevated lactate is a direct marker of anaerobic metabolism and tissue hypoperfusion resulting from inadequate oxygen delivery. Question 29. A client receiving chemotherapy develops petechiae and spontaneous nosebleeds. Laboratory findings include WBC 4 100/mm superscript 3, hemoglobin 9.8 g/dl, platelets 18,000/mm superscript 3, sodium 138 milliequivalent/L. Which nursing action is the highest priority? A. Encourage vigorous toothbrushing. B. Initiate bleeding precautions. C. Restrict fluids. D. Encourage intramuscular injections. Answer. B. Initiate bleeding precautions. Rationale. Platelet counts below 20,000/mm superscript 3 place the client at risk for spontaneous bleeding. Bleeding precautions are immediately necessary. Question 30. A client with diabetic ketoacidosis is receiving treatment. 4 hours later, the nurse reviews the following laboratory values. Glucose 250 milligrams per deciliter. Potassium 3.0 milliequivalent/L. pH 7.31. Bicarbonate 19 milliequivalent/L. Which laboratory finding requires the nurse's immediate attention? A. Glucose 250 milligrams per deciliter. B. Potassium 3.0 milliequivalent/L. C. pH 7.31. D. Bicarbonate 19 milliequivalent/L. Answer. B. Potassium 3.0 milliequivalent/L. Rationale. During DKA treatment, potassium often falls rapidly as insulin drives potassium into cells. A potassium level of 3.0 milliequivalent/L significantly increases the risk of cardiac dysrhythmias and requires prompt replacement. Question 31. A client with advanced cirrhosis is admitted with increasing confusion, irritability, and difficulty following commands. Laboratory findings include ammonia 156 micrograms per deciliter, sodium 134 milliequivalent/L, potassium 4.0 milliequivalent/L, glucose 102 milligrams per deciliter. Which laboratory value most likely explains the client's altered mental status? A. Sodium 134 milliequivalent/L. B. Potassium 4.0 milliequivalent/L. C. Ammonia 156 micrograms per deciliter. D. Glucose 102 milligrams per deciliter. Answer. C. Ammonia 156 micrograms per deciliter. Rationale. Markedly elevated ammonia levels are strongly associated with hepatic encephalopathy and can lead to confusion, hysterexis, decreased consciousness, and coma. Question 32. A client with suspected thyroid storm presents with severe tachycardia, hyperthermia, agitation, and hypertension. Laboratory results reveal TSH 0.01 μ/L. Free T4 markedly elevated. Sodium 140 milliequivalent/L. Potassium 4.2 milliequivalent/L. Which laboratory finding most strongly supports the diagnosis? A. Potassium 4.2 milliequivalent/L. B. Sodium 140 milliequivalent/L. C. TSH 0.01 μ/L. D. Normal electrolyte values. Answer. C. TSH 0.01 μ/L. Rationale. Thyroid storm is associated with severe hyperthyroidism characterized by a profoundly suppressed TSH and elevated thyroid hormone levels. Question 33. A client with syndrome of inappropriate antidiuretic hormone secretion, SIAD, develops worsening confusion and headache. The laboratory results show sodium 116 milliequivalent/L. Potassium 4.1 milliequivalent/L. Glucose 98 milligrams per deciliter. Calcium 9.0 milligrams per deciliter. Which intervention should the nurse anticipate? A. Administration of hypotonic fluids. B. Fluid restriction and treatment of severe hyponatremia. C. Increased free water intake. D. Administration of loop diuretics without monitoring. Answer: B. Fluid restriction and treatment of severe hyponatremia. Rationale: a sodium level of 116 milliequivalent/L is critically low and places the client at risk for seizures, cerebral edema, and coma. Question 34. A client with diabetic ketoacidosis is improving after treatment. The nurse reviews the following laboratory results. Glucose 180 milligrams per deciliter. Potassium 2.8 milliequivalent/L. pH 7.36. Bicarbonate 23 milliequivalent/L. Which finding requires immediate intervention? A. Glucose 180 milligrams per deciliter. B. Potassium 2.8 milliequivalent/L. C. pH 7.36. D. Bicarbonate 23 milliequivalent/L. Answer: B. Potassium 2.8 milliequivalent/L. Rationale: although acidosis has resolved, severe hypokalemia remains life-threatening because it can precipitate ventricular dysrhythmias and respiratory muscle weakness. Question 35. A client receiving continuous renal replacement therapy in the intensive care unit develops muscle twitching and prolonged QT intervals on telemetry. Laboratory findings reveal calcium 6.8 milligrams per deciliter, potassium 4.0 milliequivalent/L, sodium 138 milliequivalent/L, magnesium 1.9 milligrams per deciliter. Which laboratory value best explains these findings? A. Potassium 4.0 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Calcium 6.8 milligrams per deciliter. D. Magnesium 1.9 milligrams per deciliter. Answer: C. Calcium 6.8 milligrams per deciliter. Rationale: severe hypocalcemia can cause prolonged QT intervals, tetany, seizures, and potentially life-threatening arrhythmias. Question 36. A client is admitted following an intentional overdose of acetaminophen. Laboratory results obtained 24 hours later include AST 2400 U/L, ALT 2850 U/L, 3.6 Indian rupees. Bilirubin elevated. Which laboratory value most strongly suggests severe hepatic injury? A. AST 2400 U/L and ALT 2850 U/L. B. Bilirubin elevation only. C. Mild electrolyte changes. D. Normal renal function. Answer: A. AST 2400 U/L and ALT 2850 U/L. Rationale: massive elevations of AST and ALT indicate significant hepatocellular injury and are commonly seen in severe acetaminophen toxicity. Question 37. A client with acute adrenal insufficiency presents with hypotension, weakness, and abdominal pain. Laboratory values include sodium 122 milliequivalent/L, potassium 6.4 milliequivalent/L, glucose 58 milligrams per deciliter. Cortisol markedly decreased. Which laboratory finding requires the most immediate intervention? A. Sodium 122 milliequivalent/L. B. Potassium 6.4 milliequivalent/L. C. Glucose 58 milligrams per deciliter. D. Decreased cortisol. Answer: B. Potassium 6.4 milliequivalent/L. Rationale: although all findings are serious, severe hyperkalemia presents the most immediate threat because it may rapidly cause fatal cardiac dysrhythmias. Question 38. A client with severe sepsis has the following trending laboratory values. How should the nurse interpret these results? A. Worsening tissue perfusion. B. Progressive renal failure. C. Improving tissue oxygenation and perfusion. D. Development of metabolic alkalosis. Answer: C. Improving tissue oxygenation and perfusion. Rationale: declining lactate levels indicate improving tissue perfusion and a favorable response to treatment. Question 39. A client receiving warfarin for atrial fibrillation presents with dark stools and dizziness. Laboratory results reveal 7.2 Indian rupees, hemoglobin 8.4 g/dl, platelets 220,000/mm superscript 3, potassium 4.3 milliequivalent/L, Which finding is the greatest concern? A. Platelets 220,000/mm superscript 3. B. Potassium 4.3 milliequivalent/L. C. 7.2 Indian rupees. D. Mild anemia. Answer. C. 7.2 Indian rupees. Rationale: an INR of 7.2 indicates dangerously excessive anticoagulation and significantly increases the risk for major bleeding, including gastrointestinal and intracranial hemorrhage. Question 40. A client with multiple traumatic injuries is admitted to the intensive care unit. The nurse reviews the following laboratory values: hemoglobin 5.9 g/dl, platelets 150,000/mm superscript 3, potassium 4.2 milliequivalent/L, lactate 7.4 millimoles per liter. Which laboratory value most strongly indicates severe shock and inadequate tissue perfusion? A. Hemoglobin 5.9 g/dl. B. Platelets 150,000/mm superscript 3. C. Potassium 4.2 milliequivalent/L. D. Lactate 7.4 millimoles per liter. Answer. D. Lactate 7.4 millimoles per liter. Rationale: a markedly elevated lactate level is one of the strongest indicators of severe tissue hypoxia and shock. Persistent elevation is associated with increased mortality and requires aggressive resuscitation. Question 41. A client in the intensive care unit develops sudden ventricular tachycardia. The nurse reviews the most recent laboratory values: potassium 2.4 milliequivalent/L, sodium 138 milliequivalent/L, calcium 9.0 milligrams per deciliter, glucose 104 milligrams per deciliter. Which laboratory abnormality most likely contributed to the dysrhythmia? A. Sodium 138 milliequivalent/L. B. Potassium 2.4 milliequivalent/L. C. Calcium 9.0 milligrams per deciliter. D. Glucose 104 milligrams per deciliter. Answer. B. Potassium 2.4 milliequivalent/L. Rationale: severe hypokalemia significantly increases myocardial irritability and can precipitate ventricular tachycardia, ventricular fibrillation, and cardiac arrest. Question 42. A client admitted with septic shock has the following laboratory results: lactate 8.1 millimoles per liter, potassium 4.8 milliequivalent/L, sodium 136 milliequivalent/L, hemoglobin 12.4 g/dl. The nurse evaluates the client's response to treatment over the next several hours. Which trend indicates the best improvement? A. Lactate 8.1 to 9.0 millimoles per liter. B. Lactate 8.1 to 7.8 millimoles per liter. C. Lactate 8.1 to 2.1 millimoles per liter. D. Lactate remains 8.1 millimoles per liter. Answer. C. Lactate 8.1 to 2.1 millimoles per liter. Rationale: a significant decrease in lactate indicates improved tissue perfusion and oxygen delivery, suggesting successful resuscitation. Question 43. A client with acute respiratory failure has the following arterial blood gas results: pH 7.24, PaCO2 62 millimeters of mercury, HCO3 26 milliequivalent/L, PaO2 58 millimeters of mercury. Which interpretation is most accurate? A. Metabolic acidosis. B. Respiratory alkalosis. C. Uncompensated respiratory acidosis. D. Metabolic alkalosis. Answer. C. Uncompensated respiratory acidosis. Rationale: the low pH indicates acidosis. Elevated PaCO2 identifies a respiratory cause. Normal bicarbonate indicates little or no metabolic compensation. Question 44. A client with tumor lysis syndrome develops weakness and palpitations. Laboratory results reveal: potassium 7.3 milliequivalent/L, phosphorus 6.8 milligrams per deciliter, uric acid elevated, calcium 7.0 milligrams per deciliter. Which laboratory value presents the greatest immediate threat? A. Calcium 7.0 milligrams per deciliter. B. Uric acid elevation. C. Potassium 7.3 milliequivalent/L. D. Phosphorus 6.8 milligrams per deciliter. Answer. C. Potassium 7.3 milliequivalent/L. Rationale. Severe hyperkalemia is the most immediately life-threatening complication because it may cause fatal cardiac dysrhythmias. Question 45. A client with gastrointestinal bleeding has the following laboratory values. Hemoglobin 6.3 g/dl. Hematocrit 18%. Platelets 250,000/mm superscript 3. 1.1 Indian rupees. Which provider prescription should the nurse anticipate? A. Fluid restriction. B. Packed red blood cell transfusion. C. Potassium supplementation. D. Platelet transfusion. Answer. B. Packed red blood cell transfusion. Rationale. Severe anemia from acute blood loss requires restoration of oxygen-carrying capacity through blood transfusion. Question 46. A client with chronic obstructive pulmonary disease has these arterial blood gas results. pH 7.37. PaCO2 58 millimeters of mercury. HCO3 33 milliequivalent/L. PaO2 68 millimeters of mercury. Which interpretation is most accurate? A. Fully compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer. A. Fully compensated respiratory acidosis. Rationale. The pH is within normal range, but PaCO2 remains elevated and bicarbonate is increased, indicating chronic respiratory acidosis with complete renal compensation. Question 47. A client with acute liver failure has the following laboratory values. 5.8 Indian rupees. Ammonia 172 micrograms per deciliter. Bilirubin 14 milligrams per deciliter. AST 1900 U/L. Which laboratory value indicates the highest immediate risk for bleeding? A. Bilirubin 14 milligrams per deciliter. B. AST 1900 U/L. C. 5.8 Indian rupees. D. Ammonia 172 micrograms per deciliter. Answer. C. 5.8 Indian rupees. Rationale. A markedly elevated INR reflects severe impairment of clotting factor production and significantly increases bleeding risk. Question 48. A client receiving insulin therapy for hyperglycemic hyperosmolar state has the following laboratory values 4 hours after treatment. Glucose 260 milligrams per deciliter. Potassium 2.7 milliequivalent/L. Sodium 145 milliequivalent/L. Serum osmolality improving. Which laboratory value requires immediate intervention? A. Glucose 260 milligrams per deciliter. B. Potassium 2.7 milliequivalent/L. C. Sodium 145 milliequivalent/L. D. Improving osmolality. Answer. B. Potassium 2.7 milliequivalent/L. Rationale. Severe hypokalemia can rapidly result in lethal dysrhythmias. Potassium replacement is a priority. Question 49. A client with multi-organ dysfunction syndrome has these laboratory values. Lactate 9.2 millimoles per liter. Creatinine 4.8 milligrams per deciliter. AST 2100 U/L. Platelets 42,000/mm superscript 3. Which laboratory finding is the strongest indicator of severe ongoing tissue hypoxia? A. Creatinine 4.8 milligrams per deciliter. B. AST 2100 U/L. C. Platelets 42,000/mm superscript 3. D. Lactate 9.2 millimoles per liter. Answer. D. Lactate 9.2 millimoles per liter. Rationale. Extremely elevated lactate levels indicate profound tissue hypoperfusion and are strongly associated with high mortality. Question 50. A nurse receives morning laboratory reports on 4 clients. Which client should be assessed first? A. A client with heart failure whose BNP is 1,200 pg/ml and whose respiratory status is unchanged from baseline. B. A client with chronic kidney disease whose creatinine increased from 4.8 milligrams per deciliter to 5.1 milligrams per deciliter overnight. C. A client with diabetic ketoacidosis whose potassium level is 2.6 milliequivalent/L while receiving an insulin infusion. D. A client with cirrhosis whose ammonia level increased from 88 micrograms per deciliter to 102 micrograms per deciliter. Answer. C. A client with diabetic ketoacidosis whose potassium level is 2.6 milliequivalent/L while receiving an insulin infusion. Rationale. This client is at immediate risk for life-threatening cardiac dysrhythmias. Insulin therapy drives potassium into cells, worsening hypokalemia. Using Nclex priority principles, ABCs an immediate threat to life, this client requires assessment first. Congratulations on completing 50 Nclex, the most important lab values, the most failed Nclex labs. Lab values are not just numbers on a report. They are often the earliest warning signs of life-threatening complications. The Nclex frequently tests whether you can recognize which abnormal result is merely concerning and which one requires immediate action. As you continue preparing, focus on mastering these high-yield principles. Potassium abnormalities can rapidly become cardiac emergencies. Sodium abnormalities can lead to severe neurological complications. Calcium and magnesium imbalances can trigger seizures and dangerous dysrhythmias. Elevated lactate levels often signal inadequate tissue perfusion and shock. Critical coagulation values indicate major bleeding risk. Troponin elevations require immediate recognition of myocardial injury. Severe neutropenia dramatically increases infection risk. Always prioritize the lab value that poses the greatest immediate threat to airway, breathing, circulation, or neurological function. Remember, Nclex questions rarely ask you to simply identify a normal range. Instead, they test whether you can connect a laboratory value to a clinical condition, anticipate complications, and determine the safest nursing action. If this practice set helped strengthen your clinical judgment, continue challenging yourself with advanced Nclex scenarios involving ABG interpretation, electrolyte emergencies, cardiac marker analysis, renal failure and dialysis, liver failure, endocrine crises, sepsis and shock, multi-system critical care. The more lab values you interpret in clinical context, the more confident you'll become on exam day and in real patient care. Thank you for studying with MCQs Master 101. Stay consistent. Stay clinical. Stay Nclex ready. See you in the next Nclex Masterclass.